With the devastating cuts to home care proposed by the Department of Social and Health Services, Chris Reykdal set out to learn more about what it is like to walk a day in the shoes of a home care worker. He met Dawn Warren and her client Jackie. This is what he learned.
Well, I came to Royal Street to walk a day with an SCIU member.
Hey, how are you?
Good.
Are you Dawn?
Yes, my name is Dawn.
Hi, Dawn.
And you're Chris?
I am. Thanks for having
me.
me.
And this is Jackie.
Hi, Jackie. How are you?
Pretty good, thank you.
Very good.
Nice to meet you.
It's good to meet you. Thanks for having me over.
My name is Dawn. I've been taking care of Jackie since August. I've been working as a caregiver for about 4 years.
Well, I walked a day in Dawn's life, and I learned that she cares a lot about her work, and she respects her client, and she understands the value of these services, and therefore she puts a lot of thought and care into it.
Okay, first thing we gotta make sure is, what I normally do is I take the pillows and place them on this bench.
Okay.
The main thing we need to make sure is this bottom sheet does not have any wrinkles. And it's not because of making sure it's nice and neat. It's really because as people get older, their skin gets thinner. And so when they're laying on this wrinkly bed, that makes it feel like they're actually laying on rocks.
Gotcha.
And eventually, if they are actually bed bound, it will actually make a pressure ulcer. Do you know what those are?
I do not.
It's actually a bed sore that actually creates like a hole in their skin, like a big old huge sore.
Right. Okay.
So that's the main reason why we need to make sure the sheets always for any client is actually completely smooth.
Great. Great.
I also learned that the quality of that care matters to Jackie, the client in this case. Doing the little things, respecting the way she wants her dishwasher loaded, or respecting the way she likes her meals, and even to wipe down the handles of the bathroom and the kitchen, reducing exposure to germs. Those are the little things that can add to the quality of life of the client.
Just rinse them off, make sure there's no food on them, and then that's
Okay.
it.
That sounds pretty good. Okay.
This is the morning. She keeps them open after she takes it, so then she knows when it needs to be refilled.
Okay.
It's actually very important that she takes them at a certain time too, because she can get sick off of it.
Back here.
I'll take that.
You got it.
Right now we'll just have scrambled eggs with the sausage.
Okay.
So it makes it easier. We can actually cook the sausage, and then the sausage already has some grease to it. So what do you propose while you're in the office of wanting to do to help people like Jackie?
Yeah, the issues are so significant. Obviously, the first thing we have to do is stabilize the state budget so that there's actual resources for folks like Jackie.
Maybe I should have had less salad that time. It was in there pretty long.
Crispify it. I'm the rookie, so they're a little well done, the biscuits.
That's fine. That's how I like them.
Well, very good.
Thank you very much.
Yes.
And the other thing is, quality care, when it's done right, actually saves costs for all of us. When we talked about it today, if she takes her medications on time, it lowers her risk of falling. It lowers her risk of serious medical concerns that would then cause her to go into our acute care system, go to a hospital to get treatment. So doing it well and doing it right actually can save us money in this system. And so these providers are, these caretakers, these folks in this industry are key to that.
People don't understand what that means, not to have your dignity. And I didn't. I felt below myself. But Dawn has showed me and helped me to realize that I can have my dignity and be in my home and have my say.
This is stuff that so many of us take for granted until you can't do it. And then it's just unbelievably frustrating that you can't do it as well as you want. So had a good time. We cleaned, which was really important, getting those basics done, and also spend some time just talking with Jackie and understand a little bit about what she's going through, both as somebody who needs care and somebody pretty dependent on medicine, candidly, prescriptions. And what does that mean? What does that portend for folks when those services are cut? And so I really enjoy the face-to-face. I'm going to be a better legislator if elected because of it. I got to see what happens on the ground. I can connect that to policy development, and I hope at the end of the day we can create state policy that's better for our clients, better for our workers, and better for our state.